But it's great right now to introduce Pasquale. So we've got Pasquale here from NYU, who's going to talk to us about, the role of financial incentives and nudges in online retail spaces.
Great. I'm on mute. Can you see my slides okay and hear me okay?
You're all good, Pasquale.
Okay, great. Well, thanks for having me. Today, my name is Pasquale Rummo. I should start with that. I'm a faculty member at the NYU Grossman School of Medicine, and a lot of this work is academic based, funded by federal agencies. So I'm going to talk today about promoting healthy food purchases in the context of online retail spaces. I'm going to highlight two different projects, one that is more about economic strategies and one that's more about behavioral nudges and behavioral economic strategies. And before I do that, I will just provide some context for my work. So a lot of this context is based on literature and some statistics from the US. And a lot of it is specifically anchored in healthy eating. So in the US, we know that adults with lower income purchase and consume fewer fruits and vegetables. And conversely, those individuals tend to on average, purchase more sugary drinks than their higher income counterparts, and also purchase more fruit drinks for their children compared to other high income parents. And what's really interesting from a research perspective is that these disparities are actually wider for those who participate in the Supplemental Nutrition Assistance Program. And so I'll explain what that is because it's specific to the US. And so that is, it's called the SNAP program, and it used to be called food stamps. And it's a federally funded program where if your eligible households could sign up and they get financial benefits to help them buy food. And so ostensibly the goal of the program is to mitigate food insecurity, and there is no explicit goal for healthy eating. And so that's where researchers like myself come in and try to think about ways to leverage this program since it's federally funded and to encourage healthier eating, and do that by addressing some of the root causes like food affordability and also some other nudges that might be more sustainable without sustained funding support for them. So that's where I come in. The angle for a lot of my work is based on how can we affect policy change and how can something be sustainable and feasible. And so the first study that I'll be talking about is anchored in some of my previous work. I'll just go through this somewhat quickly, but there is work that I've done in the past with the Fair Food Network. They're a nonprofit based out of Michigan in the States, and they are one of the early adopters of this program called the Double Up Food Bucks program. And so it gives consumers $1 for every dollar they spend on fruits and vegetables. So for say you spend $10 on eligible produce, you get $10 back to spend on more of the same eligible produce. And usually that's up to a limit. Like in this context, for this study, they were able to spend $20 per day or earn an extra $20 per day. And so it's a way to address food affordability and to make produce more affordable for consumers who participate in this SNAP program. So it's only for people who are using their SNAP benefits. And so we partnered with 32 stores in this specific supermarket chain to evaluate the program. The data is from 2015 and 2016, but we published the results recently. And it was great because we had data from stores that didn't have the program, so control stores, and stores that did have the program, our intervention stores, and also data from before the program started and during it. So it was a really strong causal design. And unsurprisingly, we found that the SNAP participants who were enrolled in the program in the intervention stores had higher spending on produce in both years. And so 7% and 2%. And if anyone is curious, I can explain why we think that it decreased in the second year, mostly due to programmatic changes. But these effect sizes are actually kind of smaller than what other people have found. Ours was definitely the largest and also the most real scale. So other researchers have looked at just one supermarket, but this is the first to look at over 30 supermarkets at once. And so we saw this was effective, and we thought, if this is effective in brick and mortar supermarkets, why couldn't it be effective in an online retail setting, which is not available, has not happened in any retail store in the US yet. So we also wanted to know, well, if it is effective, is it a question worth asking? And so in the US, over the past 20 years, obviously internet use has skyrocketed just like the rest of the rest of high income countries. And more interestingly, or more relevant for the project, I should say, is that the gap between those high income individuals using it versus low income individuals has narrowed significantly over time. And I don't have a graph for it, but we also know in the past year, due to the pandemic, that online grocery shopping has skyrocketed. And so I'm sure that's a recurrent theme in a lot of these presentations. And that's happened across all income levels, even though it's still lower among low income households. And the online grocery setting is particularly interesting in the US, again, because of the SNAP program. There's a SNAP online purchasing pilot that started now 4 years ago that would allow participants to use their benefits in online transactions. And so this has been really slow in getting off the ground. It just started with Amazon in New York State and has slowly grown over time, but then in the past year has skyrocketed because of calls for equity for allowing people to use their benefits in all contexts and be able to safely acquire food. And so it's not universal yet. We're hoping that it will be universal, but it creates this setting where it's actually possible to study it for these people using their benefits, and the program would be relevant for the people using their benefits. And it's an opportunity to use both economic strategies and also behavioral economic strategies, not only at the point of selection, but also when people are checking out. And so I have a figure here that we constructed for one of our grants. It's a conceptual model of how these nudges might work. And some of you might be familiar with this already, but it basically goes through two pathways. It's both it's tapping into your intuition, so it's providing alternatives. So if you're just going in and shopping and getting what you normally like, it's tapping into that, getting you out of your just normal purchasing behaviors, your way of thinking in system one. And then it's also tapping into your reasoning system by bringing choices to your attention. So it's helping you to think about healthier substitutes, and then hopefully affecting behavior change, like decreasing fruit purchases for children, which is the second study I'll be talking about. And so the type of nudges that I'm most interested in, the next speaker, Dimitris, is a trailblazer in this respect, in terms of testing some of this for saturated fat purchases in the Gorilla platform from Cauldron. But for my two studies, the one option I'm interested in is default option. So this is, for example, placing an item in someone's cart that they would have to opt out of, to opt out of, and it lends an air of authority to tell you that this is a healthier option that we're promoting, and letting people know that it's in their cart and letting them know that they could take it out of their cart. And like I said, it's been effective in reducing, in other contexts, like reducing saturated fat purchases in simulated online stores. And then also offering swaps at point of selection. So several studies have done this already, and mine will not be the first. But this is offering, when you put something in your cart that we think is quote unquote unhealthy, it offers a healthier alternative. And so this has led to decreases in saturated fat, sodium, again, something that Dimitris might get into in his presentation. But we wanted to adopt these for the two areas of interest for me, which at the top, like I said, were fruits and vegetables and produce purchases, and also sugary drink purchases. In the first case, this is a study that I applied for a while ago, and I'm actually going to implement in the next month, hopefully. So this will go live soon. But here we're looking at recruiting a couple thousand low-income individuals who have participated in the SNAP program. And we wanted to characterize their food shopping behaviors and attitudes in a survey, and then send them over to a randomized control trial. And they'll be randomized to 4 specific conditions. And we'll be looking at their fruit and vegetable purchases. And here are those 4 conditions. The first one is just controls. There'll be no intervention. And I'll show you what the store will look like in a second. And the second is a discount, so 50% off of eligible produce. This is not the one-to-one subsidy that I highlighted earlier, but this is actually what consumers, I think, want more, which is just a 50% discount right off of whatever they're putting in their cart up to a certain amount, $20. And then default cart items. So we'll be preloading their carts with default items. In this specific study, it'll be produce, and then combining them in the fourth condition. So a standard 2x2 design here, where it'll be the 50% discount on the eligible produce, and then the cart preloaded, and those preloaded items will also be discounted. And here is what the store looks like. We're calling it Lolas. This is a store that I helped create to help develop in partnership with my colleagues at the University of North Carolina at Chapel Hill in the States. And so Lolas we're hoping to use Lolas to answer several different research questions. My colleagues are using it to look at meat intake, for example. And you can see here that the screenshot here is showing the Apple aisle, for example, and all 4 of these Apple products are eligible. You could see the label that I created there. It's a 50% discount eligible label. It tells the consumer that they can do it up to $20, so they understand how it works. And when they enter this store, they'll also see instructions to tell them what's going on about how this works. And you could see I've preloaded their cart with another apple, and that will be customized in this study to what participants say they purchase most frequently in the survey portion of the study. And then the cart shows that they got the discount, how much the discount is, and how much their total. It shows the subtotal and total. So it's as clear as we can possibly try to make it. And so, like I said, that study will launch this month, hopefully. And then in the second study, this one is newer. This is funded by the Robert Wood Johnson Foundation here. And the target here is fruit drinks. So the idea is that fruit drinks, a lot of their marketing techniques are misleading and mislead parents into thinking that they're healthier options. So we think nudges are more appropriate in this context because it's more information-based. And so our goal is to use these nudges to promote healthier beverage purchases and subsequently intake by targeting the parents of these children, specifically those who participate in the SNAP program. Again, this is the running thread of my work. And we're using 2 nudges here, shelf ranking and swaps. So I've discussed swaps already. That will be when parents add a specific fruit drink to their cart, like Capri Sun and other types of things. They'll be offered a healthier swap option. We're actually going to show 2. One is water, and other will be more fruit flavored beverages. And then a whole second tier if they decline those for 100% fruit juice. So a hierarchy of healthfulness. And then shelf ranking will take that same hierarchy of healthfulness of beverages and manipulate in the experimental condition how it looks when people are navigating the aisles themselves, and then also when they're searching for items. So the healthier items will be sorted first. And I think the most novel and interesting part of this project to me is the usability testing and interviews we're doing. So this is my first foray into qualitative research, but we will be recruiting participants in round 1. After round 1 of creating the store is done on the Gorilla platform, we'll be doing this testing and getting feedback from the SNAP participating parents themselves, learn how they shop for groceries in general or how they shop for beverages specifically, and then how they navigate our store and what they might like to see different. And then similarly, we'll be conducting key informant interviews with Fair Food Network, the nonprofit that I talked about with the Developed Food Wealth program earlier in the presentation, getting their feedback, what would be feasible for their retailer partners, and then talking to a retail partner one-on-one. So we have buy-in from at least one retailer right now to talk about whether they would take it on, what we might need to change to make it more feasible. And then in round 2, once we incorporate that feedback into our experimental store, we'll be recruiting a few thousand SNAP participating parents into an online RCT, like in the first study, and looking at whether the nudges lead to fewer purchases of fruit drinks. Then a big goal is to disseminate these findings to stakeholders like the retailers and the SNAP community, et cetera. And so those are all my studies. I think the main thing I'd like to highlight with my work is that my emphasis is always on feasibility and sustainability. Feasibility of these nudges, will retailers take them on? we're trying to bake that into the research process itself by adding a qualitative component. And then sustainability, just in general, what are we studying? Is what we're studying something that can be not only feasible, but something that can be more permanent? So something like the Double Up Food Books program, those are usually funded by entrepreneurship and federal funds, but we want something that can be much more permanent and sustainable in terms of for the retailers themselves. So I like to end by acknowledging my mentors who helped me with this on the first, especially the first study, and then my collaborators, especially those at UNC at Chapel Hill, and then my funding mechanisms. And so I'll end there. Thank you. I'll take a question if anybody has them, or wait till the end.
No, Pasquale, that was amazing. Thank you ever so much. Thoroughly enjoyed that. But yeah, remember everyone, if you have questions, put them into the question and answer box for us. We're going to be able to get to those probably as we're going through this, but also maybe we've got some time in the Q&A section later. In fact, we've got a question that's just come in right now. Pasquale, super interesting, totally agree. What will your basket default option be based on? Just a random healthier product? What if they're looking for veggies or fruit? Or is it based on certain preferences and initial choices as with the swap?
It's a great question. We put a lot of thought into that. It actually was the quote unquote aim one of our research study, was how do we develop these default options? And so because we're looking at a SNAP participants who have participated in the SNAP program, we actually have, we use data from the national, it's called NHANES, the National Health Survey in the US. And it has data on the food purchasing and consumption behaviors of a wide swath of Americans, but including those who participate in SNAP. And we're able to go in there and see what the most popular purchases are. So if we're just putting one fruit and one vegetable in the cart. I think I saw another question like to that effect in the chat. And the default will be just the most popular option that we've identified based on household size and some demographics of the participants. But in the survey itself, before they go into the randomized control trial, and this is actually the most challenging part to implement in Gorilla in general, because we want to customize it, is we're letting them choose between 5 fruit options and 5 vegetable options. Which one do you purchase the most often? And so whichever one they select is what will show up in their cart. And so that's the last hurdle for us to get this going.
No, really amazing. I love it. Let's say a big thank you to Pasquale in the chat. Everyone say thank you. We're going to hear more from later on, but right now we've got Dimitris Koudakidis, who's here from the University of Oxford, who's also going to be talking to us about healthy decision-making with online shopping.